The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, and we got another great program for you today. Something that, most people don't think about, because once you're told that something can't be, you kind of put it out and say, well, I have to rely on every drug and medication in the world. What am I talking about? I'm talking about your immune system. And the topic basically we're going to discuss is, can immune dysfunction be reversed? So I'm here to tell you this. After almost 5 decades of clinical practice, it is obviously very clear to me and many others who in my world who do what we do with the body, that the answer to that question is absolutely 100%, minimally, greatly modified, but importantly, it can be reversed. Your body is subject to its environment. It's called epigenetics. We know that you display 46 genomes. And what happens is that you got a lot of other guys in reserve. Now, if that's the case, are these guys that are sitting dormant, can they upregulate, be replaced, make a difference? And the short answer is yes, absolutely, it positively can. So we're going to get into what your doctor says. Well, you have to learn to live with it because that's what your genes are. Not so much, my friends. There's a lot of things that can be done, but immune dysfunction can be reversed, providing that you're willing to step up to the plate. When a patient comes in and sees us at the Roselle Center and our office in Ashburn as well, Core Concepts Chiropractic, and they're suffering from any kind of immunological reactions, rheumatoid arthritis, if you will, Sjogren's, lupus, and so forth. They say, well, I have to be on these drugs the rest of my life. I kind of look at them, I get really quiet, and I said, who told you that? And they said, well, my doctor and all these guys that, that I've been to, and they put me on all these medications and so forth and so on. So at the end of the day, that's not true. It can be modified. It can be encouraged. It can be reversed. Your genetic map has been influenced by what was there in conception, your parents, your mother, your father, and so forth. It goes on generationally. So if you do what they do, you eat like they eat, you live how they live, then you're going to probably have the same expression genetically as they have. But if you do something different, then the body begins to change. Why do some people exposed to the same environment, same gene markers, have a problem with immunological responses and other people don't have them? Well, we're going to get into that today, and I'm going to tell you more about it. But I want you to understand that where you are right now with immune dysfunction is something that can be altered, modified, reversed in many, many cases. So let's get into it a little bit and let's understand. And by the way, I'm going to even touch on something that many of you are going to say, what? I didn't know that. Did you know that a upper neck or upper cervical adjustment by a qualified chiropractor that's very specific can upregulate your immune response? Did you hear me? A chiropractic adjustment can upregulate your immune response. And it could be an osteopathic adjustment, osteopathic physician, chiropractic physician. It has to be very specific and done properly. And yes, it can happen. And I'll give you some data on that. You're going to say, I didn't know that. So, if you're in the delivery message of this program and you need to find somebody who can do that for you, send me a note. I will refer you. I promise you, I'll give you somebody that I would trust with my own family. And you should expect resolution, or at least help, or at least modification of a lot of different things that go on in your body. So let's get into it a little bit, and let's talk about the basic platform of what we're dealing with today. Can your immune system be upregulated? Can that dysfunction be reversed or modified in some way? So let's go for this way. It can be reversed. It can be modified. It can be upregulated, especially when you're looking at something like an autoimmune disease. It's often considered a chronic condition, but in many cases across the board, significant improvement, even total remission. And they call it remission because they don't want to hang their hat and say, oh my God, it's not there anymore. Well, I'm here to tell you that in a lot of cases, it's not there anymore. So you have to understand the problem. Autoimmune diseases, when the immune system mistakenly attacks the body's own tissue. And that's really what it is. It leads to chronic inflammatory responses in the body. And it can potentially damage organs, such as in rheumatoid arthritis, destroys joint spaces and other tissues within the body. The causes usually is a mix of genetic susceptibility, which we just talked about a little bit, and environmental triggers. That's the epigenetic platform. So if you look up epigenetics, that'll tell you what we're talking about. Now, infections, the balance of your good bacteria and your bad bacteria within your intestinal tract. It's called your microbiome. Now, chronic stress and toxins and other dietary factors have an influence on this, but environmental impact as well. In today's world, we're looking at what? We're looking at 5G networks and all the data centers that are out there, the things that are put in your water. Now they want to spray your foods, and they want to put your vaccines in your food, in your animals, in your meats, and so forth. It's like, when is this going to stop? When are we going to start looking at the body's immune system as the primary element that really truly supports us and who we are? Exercise is critical, doing it on a regular basis. And by the way, the Roselle Center in Fairfax, Roselle Center for Healing in Fairfax, is going to be doing a program this coming Wednesday evening, the 8th of the month already, right? The 8th. Dr. Lars Stevenson, our physical therapist, is going to be talking about strengthening your body's core, giving you a little bit of mobility and flexibility and so forth, and teaching you how to do this. Just a night you're going to take stuff away with you. So join us. All you have to do to register is go to drtomroselle.com. That's drtomroselle.com, and there's a spot there to register. Or alternatively, call the office, 703-698-7117, 703-698-7117, and register for the night. The only thing we ask you, as always, if you have change of plans, something comes up, please give us a call. That way we can make sure that we have room for other people, that have the opportunity and want to be there. So join us on the 8th. It's at 6 p.m. Dr. Lars Stevenson, he's a physical therapist. He's trained in the world of applied kinesiology. He's studied under me. So please join us. I think you're going to be impressed with what little things can make big differences, and how your body responds is up to your application of these things. So let's get back into the program. So if we know that we have these environmental problems, these environmental triggers, if you will, can it be reversed? Can things be turned around? Well, the truth of it is, yes, it can be reversed. It can be turned around, and a huge difference can be made across the board, right? Okay, so let's deal with this a little bit. If your immune system can be fixed, then why are we throwing drugs at it to suppress it even more? Why would we want to suppress something that can be modified on its own if it was supported across the board? Mainstream medicine focuses on managing symptoms and preventing the exacerbation, called flares, right? But functional medicine, in my world, the things that I do structurally, chemically, emotionally, clinical research is proving over and over and over again everything that we've said for, decades, and that show that many people are able to achieve major remission and resolutions by addressing the cause. Last week we talked about what the cause of things are, what's first, what's next, what's last, what really triggered the thing. So remission simply means the absence or greatly reduced expression of the disease markers and activity and so forth. Now, does that mean it's a cure? A permanent eradication of the disease is often noticed. Medicine will tell you it's not possible. They don't know, but it's not possible, they say, for most autoimmune conditions. But stopping the progression, they're happy with. I'm here to tell you that there are patients that we do blood work, we have markers, we have x-rays, we have all kinds of studies. And then over a period of time, you start seeing the patient begin to get better and stronger. Again, with the patient's cooperation, you are the partner, you must be involved in your own care. And then, a year later, we redo the blood work. And in many cases, there's no markers. They're all negative. I'll give you an example. I have a patient that came in and she's suffering with multiple myeloma. That's a bone cancer. And we see it often as people get older. So the testing that showed up was very specific. Her doctor put on medications. It dropped the markers down, but he said, you're going to have to be there and learn to live with it. So she started a program that was very, very biologically supportive of her body. She was doing frequency medicine. She was doing things with structural manipulation and acupuncture and detoxification. And within 6 months, that immunological platform that hadn't moved under traditional medication and chemotherapeutics was down to 0. And her physician looked at it and he said, well, I guess the drugs, these new biologics that we're using, remember last week's appointment we talked about, or a program we talked about biologics? He said, well, they must be working. No, because they were sitting there for a better part of a year after going through everything and nothing had moved, except that she decided to do something different. So when we have those biological suppressive drugs, all they're doing is they're knocking the symptom down. But when you have the markers that finally go away and there's nothing there, they're not detectable, and you stop the medication. By the way, we didn't tell her to stop the medication, but guess what happened? She decided, let me see what happens. And I can always go back on them. And she stopped them. And she didn't miss a beat. Everything continued the same. Now, that to me is like, oh my gosh. And so we kind of do our research and we keep looking at these things. And it's amazing to me, even though that I've seen them hundreds of times over 50 years of practice. Now, you have to identify the triggering mechanisms. Some things, let's take the gut. Let's talk about the intestinal tract. Your intestinal tract, and depending on the author, is 75 to 80% of your immune system. Why is that? It's that microbiome, the good bacteria that lives there, and it produces things like amino acid triggers that go into neurotransmitters. It has your IgA antibody response as your first line of defense. It's mucus secretion, and things that can bust it up are sensitivities to foods and even gluten. Because in this world, this country, good old United States of America, there's a lot of good things about who we are and what we do, but our food sources aren't exactly the best quality, particularly if they're, they're conventional foods, things that it doesn't say organic on them. And they've been genetically modified. The gluten triggers are much, much higher, and it destroys a lot of the gut bacteria. And then we see nutrient deficiencies because the foods we have, our chemistry set, they're not supportive. And then we have all these mold exposures and things like that. We have other infections like parasitic infections. Oh, by the way, if you had a COVID vaccine, I can almost guarantee you, if you have a long COVID pattern, you've got part of the problem is parasitic. Why'd you think ivermectin worked so well? If ivermectin was used in COVID and it actually got a response, it means that it had to be a parasite of some sort that was involved in the COVID virus. Forget about the vaccine itself. But we can get into that. That's a horse of a different subject. And one of these days, I'll really get into the depth of that. There's a lot of data that supports everything that I had been saying all the way through that time of our lives, if you will. Now, functional medicine uses advanced testing to pinpoint different triggering mechanisms. Some people are sensitive across the board. They have allergy reactions to certain things. But most allergy reactions specifically IgA mucus secretion, your first line of defense, can be modified to the point where the trigger can no longer be, triggered, if you will. Okay. So here we go. Now we have to focus on foods. We have to heal the intestinal tract. We have to heal the gut so it's not permeable. We have to look at the different enzymes, things like zonulin, that is a gatekeeper in the little spaces within the intestinal system that stops the body from things going into the body too quickly and causes inflammatory reactions. We have to repair the gut. We have to repair the intestinal tract. Now, sleep cycles. How many of you go to bed the same time every night and get up the same time every morning? I would gather to guess some, but not many of you, because we got to watch the television. We're still on our phones. We're on our computers. And then when we go to bed, what's the environment like? We got the lights on. We have, 5Gs that are blasting around us. We have to look at our individual environmental platforms to be able to change anything. How about stress? We're in a world of all kinds of stress. We have techniques like mindfulness and prayer and yoga and meditation and so forth, and it helps us relax. But how many of you actually employ those things on a regular basis to calm the body down, to put yourself into repair, parasympathetic, and then into REM cycle, which is a natural reparative cycle in your sleep? Or are you waking up throughout the night because your cortisol is spiking? Are you waking up through the night because your blood sugar is crashing, which increases the cortisol response in your body? And then, your hormones are not balanced properly. So you have to get up in the middle of the night and you have to urinate, and whether it's a guy or it's a woman. Look, there's so much that I want to tell you. We're going to get into, we're going to talk about different nutrient deficiencies that you have to be aware of. I'm going to tell you how to get them if you're not a patient of ours. And look, realistic expectation is simply this. Long-term commitment to your health is what is necessary to reverse, to replace, to upregulate immune conditions that have been suppressed for a long period of time. Remember, I'm going to tell you at the end of the program, we're going to talk a little bit about upper neck cervical manipulation. Say, oh my God, nobody's going to touch my neck. My doctor told me not to do that. Well, I'm going to tell you that your doctor doesn't know what her or he are talking about. And I'll tell you why. And it's safe. My children, my grandchildren, my godchildren were all treated from a chiropractic platform within an hour of their birth. Now, you say, what? Why would a child? I'm going to tell you a little bit about that as well. But look, here's the deal. If you understand there are mechanisms that can upregulate your immune system, if there are mechanisms that can reverse your gene expression or modify it dramatically, don't you want to know more about it and who you could see to actually give you data? Well, that's what we do here. And we're going to give you all kinds of information. And don't forget, the Roselle Center has multiple tentacles and referral bases and the like. So we're going to talk about immunomodulatory therapies, things that will help the body, but we're going to do that when we come back. You're listening to Ageless Health with yours truly, Dr. Tom. Don't go away. Don't touch that dial. I'll be right back after some very important messages. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation.
Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody. Welcome back. This is Dr. Tom. You're listening to Ageless Health, and we have an interesting program. What are we talking about? We're talking about upregulating your immunological response, but more importantly, the question becomes, can you reverse genetic weaknesses in your immune system? And the short answer is absolutely, positively, yes. And that's with 50 years of experience watching people who come into the office with very specific immunomodulatory suppressive patterns and being able to see them get well. And then the blood test says, I can't find the markers anymore. And that's not because of a drug. That's not because of a biologic, which we talked about in our last get together a week ago. But more importantly, we're seeing things that seem to go away and don't come back as long as the patient doesn't put themselves back into that environmental suppressive piece, which knocks everything out. So remember we said that your immune system you're born with a certain expression of 46 different gene markers. Now, those are the ones that you show. Those are the ones that are up on the surface. It's not the ones that are sitting back dormant or the ones that can be modified based on what you got going on right now. So just because you're showing a methylation problem, because your genetic markers say that everybody in your background, your family has this methylation problem, are you stuck with it? Do you have to just throw nutrition at it and make sure that it's okay? Well, the short answer is maybe and maybe not, because if you do the things that are right, remember, you are the partner in your own health, then maybe you can begin to resolve these conditions. At the Roselle Center for Healing and the Roselle Center group of practices, we look at every piece of what makes you you. We look at the neurological platform. We look at the biochemical, bioelectrical platform and exposures. We look at how your brain runs on an ongoing basis. Look, here's the deal. We want to make sure that you understand that your body will respond based on its exposures. We call that epigenetics. So that means everything that's around you that stimulates the expression or suppresses your genetic map, right? Epigenetics. You can look it up. Now, again, when we talk about mainstream medicine, allopathic medicine, drug, for this situation, medicine, what they're trying to do is they're trying to suppress the immune expression, the problem, the symptoms, the irritation, the rashing, the gut that doesn't work the way it's supposed to, the rumblings, all those things that continue to show up, the chronic pain patterns, which you've heard me talk about. Now, dietary patterns are critical, right? Now, you can eliminate a lot of what are known inflammatory foods, things like grains and beans and nuts and eggs and seeds and nightshades, and then introduce them one at a time. But did you know through neuromuscle function response testing, which we do with the majority of our patients so we can find out what's really going on with them, that you can identify specifically what these guys are? Like it could be dairy, it could be a nut, it could be whatever it is. But sometimes just testing something doesn't show it. You have to test the organ system, the liver, the intestinal tract. That is a problem. Now, in my world, here's an interesting concept. Every muscle in the body, your chest muscles, pectoralis muscles, your shoulder muscles, the deltoid muscles, your thigh muscles, the quadricep muscles, they all have a relationship to an organ system inside the body. How does that happen? Well, you have a brain, spinal cord, 31 pairs of nerves that come off the spine at different levels. And when those nerves come off, they divide. One branch goes to the organ, one branch goes to the muscle. That's technically what's called a visceral somatic reflex arc. That means visceral organ system, soma means muscle, and they talk to each other neurologically. And it's off the front portion of the spinal cord. That's called the ventral portion of the spinal cord. Now, if there's any irritation to the organ, it goes to the spine, and then it spills over into the muscle. So the muscle now can show a weakness, an inhibition of function and functional capacity. So as you test the muscle, if it's fully facilitated, we can use the word strong, but it's not a strength test between you and the practitioner. Does the muscle lock or not lock? Or is it inhibited? That means, is it weak? And it doesn't mean that it's blatant, you can't lift it. It just doesn't lock as quickly as it should. It tells you that there's something amiss. Now you have to dig. You got to find out whether it's a nutritional problem, whether it's a predisposition genetically. For example, let's say that you have chronic hip and knee pain, and nobody can figure out where it's coming from. But nobody remembered to test the thigh muscle, the quadricep muscle. Quad means four, right? So there's four different muscles that make up your thigh, your front of your leg. And you have to test them properly to be able to find out which one is not firing. Then the next question is, why? Well, remember I just said organ muscle? Well, that thigh muscle relates to the small intestine neurologically. So if the small intestine is being irritated because of all the garbage that we put in our bodies, the sugars, the sodas, the coffee, the black teas, the fast food, the fried foods, the alcohol, the gluten, additives, GMO products, I'm tired already. Those connections neurologically are not going to work the way they're supposed to. So what do we do about it? We fix the spine. We can give a good structural adjustment and get it to free up for a while, but it's going to continue to come back until we fix that gut. So the microbiome, the good bacteria is off. It's being replaced by other nonsense. If you will, the texture of the intestinal system is not what it should be. It becomes hardened and so forth. There's these little hair-like follicles that come off the intestinal system. They're called intestinal villi. And if things aren't good there, those things shrink down and they don't work the way they're supposed to. So all these little guys, one to the other, causes that thigh muscle, that quadricep muscle, not to work. So we've got the acupuncture system, we've got the nerve root, we've got blood supply, but the triggers are inside often, or in some cases, there was a blatant injury to the low back that may have caused that thigh muscle not to work. So what I know it's confusing, but what I'm trying to get you to understand is it's not just a one and done situation. It's not just take this anti-inflammatory. It's not just, let's send you to physical therapy. It's not just, even with chiropractic care, which I think is one of the most miraculous things on the planet, it's not just giving a good specific adjustment that allows it to resolve the problem. Now, you have to be part of the fix here, my friends. So we have to look at gut restoration, right? We have to fix, you've heard the term leaky gut, and that goes to, remember I said in the last segment, something called zonulin. So you have these zonulin gatekeepers. Look it up, Zonulin, zonulin. And it's, if these things are depleted, if that chemistry is depleted, if that enzyme is depleted, then you're going to have a leaky platform. It's like taking a sieve. You know how you put rice or you put pasta in a sieve and you get the water all out of it and it drains it out. That's what happens, is that it becomes uncontrolled. And now you got all this nonsense and the inflammatory levels get really high and so forth. So we want to look at that leaky gut, and we're going to support it with good probiotics. Megaspore probiotic is a good one. And I'm going to tell you where you can get that. We're going to get into a little bit of the how to upregulate your immune response. It often requires managing over a long period of time. If you hurt something and you continue to go back and re-injure it, even though that it's healing, it's never going to heal completely. It's going to get scar tissue, the tissue is going to change and so forth. But if you leave it alone and you continue to support it and you put emollients in it and you give it good collagen support, guess what happens? It's known that it will resolve itself 100%. Interesting, right? Now, you have to incorporate many things: exercise, stretching, breathing. And by the way, which brings me to remind you, on the 8th, coming up next week, the 8th, here at the Roselle Center for Healing in Fairfax, Dr. Lars Stephenson is going to be doing a night on stretching and flexibility and how to keep that body loose without killing yourself, without just little things that you can do. So join us. And I think you're going to find out that there's a way to stay out of the gym. You can do it at home. You can do a lot of things on an ongoing basis. So it's going to be at 6 p.m. at the Roselle Center in Fairfax. Call us, 703-698-7117. Join us and show up. You know, you can also go online. Go to drtomroselle.com. Now, let's get a little bit into nutritional products that will help reverse the ugliness within your body. And very simple things, little things that make a huge difference. And remember that I said that you can get all of these things, you know, on our online store. Go to drtomroselle.com, and you're going to go in there, and there's a store that is going to lay it all out for you, right? You're going to find all kinds of wonderful little tidbits that are available to you. So if that's the case, guess what? You got to go do it, right? You got to make sure that, you know, you have the availability, if you will. So vitamin C, good old vitamin C. You can get it in vegetables, got to eat a ton of it, right? Citrus fruits and bell peppers and berries and leafy green vegetables and things like that. Vitamin C boosts your white blood cell production. Simple as that. So if you got a low white blood cell, if your doctor just did a blood count on you and it comes back, I think the lower levels today are like 3.7 thousand up to about 10,000. The actual number should be between, the sweet spot is between 5,000 and 8.5. Now, so if you're down in the tubes and you want to bring that up, you need to make sure that you're getting a whole bunch of vitamin C. I would recommend that you get at least 600 milligrams a couple times a day if it's low, and begin to watch your dietary patterns as well. Now, you can get that as well online. As I said earlier, you go into the Ageless Health store, and you're going to push the button and you're going to go find the stuff, and it's there for you, and they're going to ship it to you, and it's an ongoing process. Look, vitamin D. Do you know that in the area that we live in, if you're listening to my voice, you live in a latitude in the good old United States that vitamin D is not stimulated very well, and about 80% of us are either fully deficient or very, very low in our vitamin D levels. So what do you want to do? You know, your doctor say, well, you take 400 milligrams, 1,000. Not so much, my friends. The parameters in vitamin D, the medical labs is 30 up to 100. And if they get you above 30, say you're good to go. Not so true. You're still an accident waiting to happen. You're still looking to break a bone. You're still not going to heal the way you're supposed to. You're still not going to stimulate your body's immune response. You're still not going to reduce your inflammatory reaction. that vitamin D level should be at least 80 to 90, 95. I like to get up close to that 100 marker. Functional medicine normals, depends on the literature, will get you up even closer to about 150. So you take a bunch of this stuff. I would encourage you to start out with about 10,000 a day, redo your blood work in about 120 days. And then based on what it shows, never drop it lower than about 5,000. There's a few of you out there that, you can get down to 2,000, 1,000 to 2,000 a day if they're outside playing. If they're not, you may have to increase it beyond that. But vitamin D, fatty fishes, if you will, egg yolks, and sunlight. But, to get enough vitamin D sunlight, you'd have to have at least 70% of your skin exposed, even in the summertime, and be outside for about 45 minutes. Now you'll get enough vitamin D if you do it every day. But if you don't do it every day, you've got a problem. How about zinc? Zinc is critical. Do you know that the Roselle Center tests every patient for zinc? We do, it's called a zinc tally test. We put a little bit of zinc sulfate, it's a specific form of zinc, in your mouth, and we ask you what you taste. If you don't make an ugly face where you're puckering up and go, ugh, what was that? Immediately, not after a few seconds, but immediately, then your vitamin D level is either insufficient or it's very low. So this zinc, I'm sorry, not your vitamin D, but your zinc level is very, very low. So zinc increases the development of neutrophils, natural killer cells, T cells, things like that. So you need to make sure that you have enough zinc in your body. And guys, did you know that when you have prostate problems, that old thing that yours gets swollen and you can't urinate anymore? That's often a zinc deficiency. I wrote a paper years ago, a white paper called Zinc and the Prostate Gland. And the dry weight of a good, normal, healthy prostate in a man is, guess what? 50% zinc. So as the zinc levels drop, your prostate gets swollen. If you want to reverse it, you have to add zinc to the platform. Vitamin A, one of the best things you can do, supports your mucous membranes, your Ig antibody responses. How much is enough? You can take 5,000 a day, but at least get some ongoing. You look at foods like chickpeas and beef, and that doesn't have it. So you're going to look at anything that's colorful. Sweet potatoes, carrots, spinach, fatty fish. And then you look at your probiotic, right? You have to keep the gut healthy. We talked about that with, the gut being the gatekeeper, if you will. So when we talk about probiotics, we know that it supports the lymph tissue, which is part of your immune system. It strengthens the intestinal barrier. Remember, we talked about zonulin. And you can get that omega-3 fatty acids and vitamin D from a lot of sources, but the omega-3 fatty acids are the critical piece we're talking about. And we're talking about things like sardines, and we're talking about mackerel, we're talking about salmon, wild-caught salmon, not farm-raised. Stay away from the farm-raised junk, wild-caught. And omega-3s dramatically reduce inflammation. My opinion, I've got 2 degrees in functional human nutrition. Omega-3 fatty acids are as effective in low-level blood clotting preventiveness as any kind of the blood thinners that you're going to take. But you have to pick the right one, and it has to be at the right level, and they work without, by the way, the bruising that you get on your skin if you bump into something, without taking the baby aspirin, the 81 milligrams, because, if you've listened to the programs, I've said before that an ongoing use of 81 milligram baby aspirin increases your risk of hemorrhagic stroke if you bump your head, because your blood's thin and you're going to bleed if you bump on anything. Fatty acids don't do that as far as omega-3s. Omega-3s will not cause that same problem. You'd have to take a ton of it on a day-to-day basis to even get close to that type of situation. Elderberry is great, particularly for children. I will give them that sometimes even before that. I give them vitamin C levels. It depends on things. Resveratrol. I like mine in a glass of wine, but you may want to do it on other things like really dark chocolate, right? That works really well as well. Look, you got to eat a variety of colorful fruits to get, but enough of them to make sure. You got to make sure you're very hydrated. You got to sleep at the same time. You got to get some exercise ongoing. Now, I promised you in the last segment of the program, we're going to talk about upper cervical, upper neck manipulation and what it does for immune response. I think you're going to be very, very surprised. There's study after study after study in the world of chiropractic and osteopathic medicine that have shown that people who get regular adjustments, meaning manipulative treatment of their structural system, are healthier long-term than people who do not. And your immune system is significantly better across the board than virtually anybody else that's out there. My children were rarely sick because they got manipulative treatment on an ongoing basis. They got acupuncture, their mother's a nutritionist, so they did well. So they got through life in a very, very good place. Look, we're coming up to a break in the program, and I'm going to kind of put this all together, but I will go over, what the upper cervical treatment can do, and I'm going to tie it into one of the biggest pandemics that we ever had in the United States, far worse than COVID. What am I talking about? I'm talking about the Asian flu back in the early 1900s, where it killed millions and millions of people worldwide. I lost my grandmother, my father's mother, from that. And unfortunately, I never did get a chance to meet her because she was in the old country. And my father and parents came over to this country and never saw that part of the family again. But I'm going to kind of tie that in together for you so you understand what you can do for yourself if you take the opportunity to really put things together. So you have to make sure that you look at everything that you're doing. You have to make sure that you look at the foods that you're eating. You have to realize and understand and adopt that, yes, in fact, that you can reverse virtually anything that it takes. There's some glitches that happen. You lose a leg, you're not going to regrow it, at least today. Who knows coming down the pike? If you end up with a retinal detachment, you may lose your sight. And in most situations, you've lost the sight. But guess what? They're actually working on things that will reverse that. Who knows what's going to happen when they learn how to grow your own tissue and be able to give it back to you. That's coming too. It's kind of weird stuff, but it's coming down the pipe very, very rapidly. We're going to take a break, but I want you to remember all these things that we're talking about, and I'm going to tell you about that upper cervical response after these very important messages. Don't go away. Don't touch that button. You're listening to Dr. Tom. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. You're listening to Dr. Tom. This is Ageless Health, as you do every weekend at the same old time at 7 a.m. in the morning. And it gets your day started the way it's supposed to. We're up and functional, so guess what? We're giving you all the information that you need to have to live your life well, strongly, and to give you the certainty to be able to reverse almost everything that goes on in your health. So having said that, I promised you that we're going to talk a little bit about the world that I'm in structural, manual, neurological balancing, structural manipulation, and so forth. And the osteopaths do it, chiropractors that have been doing it for in excess of 100 years. Do you know that chiropractic has been around since 1895? 1895, we're talking about over 120 years. That's kind of cool, right? So actually 130 years, where my math is. It's like crazy today. I'm sorry. But let's talk about upper cervical manipulation. Is it something that, in fact, can increase immune response? Well, I started out by talking about the time of our lives where we had a pandemic that was much worse globally than what? Than COVID. And we talked about the Asian flu. And I said that my dear grandmother, who I never met, passed away from that. And she was a young woman when that took place. Now, interesting study in the good old United States. There was a study, and records were kept out of one of the original chiropractic colleges in Davenport, Iowa, Palmer College of Chiropractic. And the numbers are going to be, that I'm going to quote, are going to be close, because I don't have the data in front of me, but it's something that I've owned my entire career. People who were treated medically during that period of time, okay, they got sick and they went to see the medical doctor. 1 in about 775 people died. Now, people who got treated chiropractically and they received ongoing adjustments, meaning manipulation of the spine, including the upper cervical spine, 1 in over 3,500 died. That's a huge differential. If that is the case, why was that information suppressed so long for so many years, except for people like me telling you the truth about what's there? There was an interesting study from the American Spinal Research, the Australian Spinal Research Foundation, and they talked about upper cervical spine, upper neck treatment, and immunoglobulin A. That's the first line of defense throughout your body, but it's mucus secretion antibody. And we're going to talk and touch upon that a little bit. But recent research is very finger pointing. It says that upper cervical manipulation can boost certain immune markers, particularly what we talked about is secretory immunoglobulin A, SIGA antibody. It is the key antibody that's the body's first line of defense to everything that happens, viral patterns, bacterial patterns, virus or fungus, and so forth. Wow, right? So if that's true, why isn't everybody going to a chiropractor on an ongoing basis? Now you're talking about medical politics, and we can get into that on a different level at a different time. There was a study that came out in 2023, and it's the Journal of Chiropractic Medicine, found that after 1 upper cervical adjustment, just 1, And right at the occiput cranial area, right at the top level, the SIG antibody that were measured from saliva, from salivary saliva, significantly rose. It rose significantly, and the baseline shot up within 30 minutes of that adjustment. The increase was temporary, but they said that temporary meant over 2 weeks. Well, guess what? If you were in a crisis situation, you were struggling, you got adjusted, you got chiropractic manipulation, a little over 2 weeks, every 2 to 3 weeks. Do you think that your immune system would be much stronger? I'm here to tell you that, in fact, it does. My children, my grandchildren, my godchildren all get treated regularly, and they are almost never sick. And if they do, it gets turned around immediately. SIGA, secretory IgA antibody, the mucus secretion is found in saliva and tears and mucus, right? Blocks pathogens from crossing into the body. It stops it cold. And the reason that some of these guys get in is simply because of the fact that there's not enough of that sitting there, because we're beating our bodies up. So here's the deal. A study also measured C-reactive protein. It's an inflammatory marker, and alpha amylase, with no major changes in coronary or in C-reactive protein, and it tended to stay solid for a period of time. Now, look, if that's the case, my God, why don't you find out what you can do to keep your immune system up just by going to a chiropractor on a regular basis? Go to a dentist periodically. What's more important than your immune system? What's more important than keeping your nervous system at a place where it can regulate your immune response? I don't know about you, but what does this mean? Does this mean, is this SIGA transient? Is it just, a shot in the dark? Is it a temporary effect? Or does it have potential benefits with people who have immunological reactions? When you come to see me, we're going to be looking at your biochemistry. We're going to be looking at your sensitivity reaction. We're going to look at your gut. We're going to look at your fight-flight system. We're going to look at your body's suppression of your SIGA response. But we got to find out why. It's not just throwing something at it. What is the triggering mechanism that's dampening it down, and how can we support it so it resolves itself permanently? What do you have to do? What do you have to do to make a difference? Temporary increases in SIG antibody can activate your immune response. Again, the effect is not permanent if you get one and done. It's like you can't maintain a muscle if you only exercise once. You can't make sure your brain doesn't train if you don't read and challenge it ongoing. But if you get treated every few weeks, you go in the gym much more rapidly than that. If you get treated every few weeks, wouldn't that make sense if it was going to a small investment in your health to keep you strong, so you don't have to wear the stupid mask when everybody's trying to scare you, when you have to stay away from people, that you turn your head and not want to kiss anybody anymore? Listen, chiropractic, natural therapeutics, biochemical platforms of nutrition are what the body needs to support itself. Don't forget, coming up the 8th this week at the Roselle Center for Healing in Fairfax, we're going to be doing a night on stretching and core training, and Dr. Lars Stevenson is going to be your host. Join us. The guy's great. He knows his stuff. We're coming up to the end of the program, but I want you to think it through. I want you to remember these things that we talked about. Go to drtomroselle.com. All the nutrition that we talked about, it's there. Go to Ageless Health store, pull it down. You'll get it done. You're watching this and listening to this because I want to do it for you. I want to give you the information that you need to have. Remember, I'm here on a weekly basis because you need the data. I want to make sure you get the right data. I want you to get the truth. Simply one reason only. I love you all. See you soon. Take care of yourself.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity be kinder to one another. Does it feel like heaven to make another's day?